Vaccines are very important part in pregnancy. Which vaccines to be given, how many vaccines to be given, why vaccines are given, what if we do not give the vaccines. We will discuss all about vaccines in pregnancy. Good morning, I am Dr. Rajat and you have started watching our YouTube channel, Fertility Gynecologist. What are vaccines basically? Vaccines are inactivated form of bacteria or viruses which are injected into the body, and those inactivated form of bacteria or viruses, they form the antibodies in the body, and when the actual disease attacks, actual bacteria or virus attacks those antibodies which have already been formed in the body, they will neutralize that attack and they will decrease the severity of infection and thereby prevent the disease. Most common vaccine given in pregnancy is tetanus toxoid. We normally give 2 tetanus toxoids in pregnancy. It is absolutely harmless. Why tetanus injection is given in pregnancy is because tetanus is a very deadly disease. It is very common in India. It is caused by Clostridium tetani, which is a gram-positive spore-forming bacteria, and it is a very resistant bacteria. It can survive for years in the dust, in the heat and humid climate, and that is why the vaccine needs to be given. Tetani, it causes a disease called as tetani, which causes the contraction of all the muscles in the body, and especially if the muscles of larynx and respiratory system become spasm, the patient may die. This tetanus, if it occurs to the neonate, it causes lockjaw. That means that neonate cannot drink milk and that neonate may also die. Therefore, to prevent maternal mortality from tetanus and neonatal mortality from tetanus toxoid is given, especially in developing countries and in a country like India. There are 2 doses of tetanus which needs to be given. The first dose should be given as soon as the pregnancy is diagnosed, and that is why most of the ASHA workers, most of the Antibody workers, the moment the pregnancy is diagnosed, they give the tetanus toxoid injection. We as doctors normally have a tendency to give the tetanus toxoid injection first time in the 4th or 5th month of pregnancy. And the second injection is given at least 4 to 6 weeks after the first injection. There should be a gap of minimum 28 days, 4 weeks after the first injection. So normally we have a tendency to give it in 4th and 6th month or 5th and 7th month, whatever is preferable. You can complete the doses in the first 3 months also, but we normally give in 4th and 6th month. If for some reason the female has had a last pregnancy within 5 years, last delivery within 5 years, then we normally give only 1 booster dose of tetanus toxoid injection and we do not give the other injections. Suppose a female has not taken any injection and she comes to us directly in the 8th month of pregnancy, then we will give the first dose of tetanus, and if the delivery occurs within one month of giving the last injection, then during the delivery we will give tetanus toxoid to the mother, tetanus toxoid to the baby, and tetanus immunoglobulin to the baby also. That is very, very important. To prevent tetanus, we were taught 5 cleans should be there: clean surface, clean cut, clean hands, clean towel. That means asepsis should be there during the delivery, and that is why the home delivery or the delivery by the gynes should not be encouraged. Every delivery must be a hospital delivery only, and that is the emphasis of WHO and the government to prevent the tetanus. That is very, very important, because however you may try, the asepsis cannot be maintained in the out of hospital surroundings. In last few years, 10-15 years, instead of plain tetanus, we have started giving diphtheria tetanus, that is DT injection. It also, the injection schedules, the injection dosages are almost similar to the tetanus toxoid injections. We give 2 tetanus, and in the last 10 years, 5 years of pregnancy, delivery, we give only 1 booster dose. There is also one vaccine which has been added in last 5 to 7 years, that is called as Tdap. T stands for tetanus, D stands for diphtheria, and AP stands for acellular pertussis vaccine. Pertussis is a life-threatening bacteria for the neonate. It causes respiratory illness, and the respiratory illness may cause the death of neonate if the vaccine is not given. So for all practical purposes, between 27 to 36 weeks of pregnancy, you should give, or a female should take, 1 dose of Tdap injection. That Tdap will not only prevent the pertussis in the neonate, it will also prevent the mortality from the pertussis. Suppose for some reason in first 3 months of pregnancy or first 4 months of pregnancy, a female comes with a wound injury or a road traffic accident and tetanus toxoids needs to be given and she is pregnant. If at that point of time Tdap can be given, and that Tdap if it is given, then you do not need to repeat Tdap between 27 to 36 weeks of pregnancy. You only need to give 1 Tdap in pregnancy. Apart from Tdap, there are 2 other vaccines which I need to make you aware of. One is a Hepatitis B vaccine. It is not given routinely. It is given in those females who are working in high-risk professions like doctors, nurses, healthcare workers who are exposed to Hepatitis B routinely. For those females, a vaccine of Hepatitis B should be taken. One more thing, if a female is Hepatitis B positive, HBsAg antigen positive, then during delivery, there is no need of giving Hepatitis B vaccine to that female, but after delivery, immediately after delivery, the Hepatitis B immunoglobulin has to be administered to the baby because Hepatitis B is vertically transferred from mother to the child. To prevent that, Hepatitis B immunoglobulin should be kept ready at the time of delivery. This is a flu season between July to February every year. Most of the people get flu infections. Every year the strains of flu keep on changing. That is, and also this flu causes severe respiratory illnesses in females. And for all, like I said in my previous videos, pregnant females are already immunocompromised. They tend to get more infections and respiratory infections are most common. So everywhere worldwide, there is a protocol that every adult should get 1 flu vaccine every year, depending upon the strain which is prevalent in that local area. The flu vaccine would not prevent the incidences of flu and respiratory illnesses, but it would decrease the severity and morbidity because of those respiratory illnesses. Maybe the pneumonia or the high grade illness or the severe illness because of flu may not be there. It would be only mild or respiratory tract infection. Apart from that, the general hygiene measures should be followed, like frequent washing of hands, using of a mask whenever going outside. They should be followed to prevent the flu infections. These are the most common and frequently given vaccines in pregnancy. If you have any questions regarding vaccines, please message, comment, or you can DM us. We request you to like the video, share the video, and please subscribe to our channel. Namaskar. Bye bye.